Hi, everyone. Welcome back to our YouTube channel, Staying Compliant with KW Advanced Consultant. My name is Keisha Wilson, and I am the founder of KW Advanced Consultant. So if you watched our last YouTube video, we discussed one of my favorite acronyms, which is called MEAT. And no, I wasn't talking about meat or chicken, but I talked about monitor, evaluate, assess, and treat. And this is an acronym we often use in the risk adjustment, HCC realm, but I also like to use it for the general documentation and coding guidance. So today I want to talk to you guys about another one of my favorite acronyms, and that is called TAMPER. And we also use this acronym in the risk adjustment HCC realm. So TAMPER means treatment, assessment, monitor, plan, evaluate, and referral. So we're looking to see how are providers monitoring these patient conditions? What are the treatments? Are they assessing the medications? What's the plan for the patient after they're monitoring them? After they evaluate them, what's happening? What's next? Do they have to give a referral? So this is important when we go through the documentation because it's going to help give a consistent flow again from the chief complaint all the way to the assessment and plan. So let's go over it in detail. Last time we used a diabetic patient, so let's stay consistent. We're going to use a diabetic patient who comes in for a follow-up visit with their primary care provider. The patient has type 2 diabetes, they're on metformin. So it's important that you mention the medications, first of all, the type. If there's a type, if there's a severity, you want to document that in the medical record. You don't want to just say unspecified or just have DM, because it could be type 1, type 2, it can be due to something else. So it's important to always be specific with your documentation for the codes that you are, for the conditions that you're treating, right? Same thing with heart failure, right? Systolic, diastolic, is it both? Is it chronic? So you want to keep that in mind when it comes to documentation and reviewing of the records. So treatment, we have the condition that's being treated. We know that the patient's on medication. So now let's move over to assessment. How is the provider assessing this patient's condition? They have reviewed their recent blood work, and the A1C is elevated to 9.2. We know with a diabetic patient that is really high. So now, how are we monitoring the patient? So we know we reviewed the blood work. We know that the A1C is elevated to 9.2. So the provider decides they want to return the patient in a month. They're going to do repeat blood work before the patient comes back in a month because they want to see if it's at a consistent 9.2, if it's going to be elevated, or if it's going to decrease. Now, we know with diabetes, oftentimes comes other chronic conditions. So the patient may have chronic kidney disease, they may have hypertension, diabetic neuropathy. The list goes on. So it's important with diabetic patients that providers continue to monitor them, especially if there's an elevated A1C. So we went over the treatment, we went over the assessment, we went over how they're monitoring the patient because they're watching their A1C and they're going to bring them back in. So now we move on to what's the plan for this patient. And the plan is often come together after assessment and monitoring, right? So it should be documented what the provider's next steps are for this patient. So we know that they're bringing them back in a month, they're having repeat A1C, but now after further conversation with the patient, they note that the patient hasn't been eating well. So they use this opportunity to discuss diet and exercise with the patient, consistently checking their insulin level at home, consistently taking their metformin and being compliant, going over the disease process of diabetes, as well as chronic conditions and exacerbations and what it can cause. So now we're moving on to evaluate. How are they evaluating the patient after this plan? We know again with diabetes comes complications if it's not controlled. So the provider is evaluating the patient's eyes, checking their feet to make sure there's no diabetic neuropathy, and any other evaluation that's done for the patient that day is clearly documented in the record. So now we move on to the referral. And now we have the whole picture of what's going on with the patient, right? We know they came in, type 2 diabetes, on metformin, A1C is elevated to 9.2. They have not been eating well. The provider gives diet counseling and coordination of care about diabetes and the disease process and being consistent and compliant with medication. And now we move on to the referral. The provider now sends the patient back to their endocrinologist as well as nutrition counseling to continue to further educate the patient on diabetes and making sure they're following up with the provider, as well as helping the patient come together with a plan for staying compliant with eating and healthy eating so that their A1C can come down when they recheck it the next month. So if you keep the term tamper in mind when you're documenting, it should be a consistent flow again from the chief complaint all the way to the assessment and plan. It should be clear of how the provider is treating this patient, evaluating them, monitoring them, what's the plan, how they're referring the patient. And so by the time you reach to the diagnosis code, it shouldn't be an unspecified diagnosis code. You should also be coding it to the highest level of specificity because documentation was detailed and it's clearly documented in the record. So I hope this helped. You have the option of always using meet or tamper, whichever suits you. But it's always important that if your providers do not know about either one of them, that you educate them on the importance of documentation and being compliant and showing medical necessity and coding diagnosis codes to the highest level of specificity. So not just for the HCC and risk adjustment realm, but just for being compliant with general documentation and coding principle as a whole. So thank you guys for liking and subscribing to our YouTube channel, staying compliant with KW Advanced Consultant, and stay tuned for our next YouTube video. Thank you so much and have an amazing day.